I've been working for a while on how to improve clinical documentation. The clinical informatics community has tried to tackle that over the past decade, has been through trying to force structured data entry. However, that has led to a huge amount of resistance among physicians. And so the adoption of that non-AI based approach to try to collect higher quality data has actually been very, very poor. What my research group at MIT, together with Beth Israel Deaconess Medical Center in Boston, has been developing is an AI documentation system that we call MedNotes. The idea that we have behind MedNotes and its predecessor that we have deployed at Beth Israel is that we're going to have clinicians do documentation just as they would normally do. And our AI algorithm will be taking the past medical history that we have on patients and will do an autocomplete, just like the autocomplete that you would have on your cell phone if you're typing a text message. And we'll autocomplete what we think the clinician is about to document next, but we'll do it in a way where behind the scenes is actually structured data that we're gathering. And in that way, we're actually able to get clinicians to enter in much higher quality structured data that could be used for things like inclusion into clinical trials or retrospective quality improvement efforts, but not take them outside of their workflow. And that has led to incredible adoption. So I'm particularly excited about some work that my research group at MIT has been doing over the past 2 years on empowering patients through the lens of their electronic medical records, specifically the clinical notes that are written by physicians at visits. And we did a study where we asked patients to donate their electronic medical records, in particular the notes, from their past visits. We took those records with those patients' consents and we de-identified them. We sent them through large language models like ChatGPT. And we started to transform the notes into forms that we thought would be much easier for patients to understand. So for example, you could take very complex medical language and translate it into a much easier to read note that doesn't use complicated medical terminology. And what we found through a number of user studies is that really helps patients better understand what's going on, helps them better understand their treatment options and what their follow-up actions have to be. For example, they have to go in for getting a lab test result next week, or they're supposed to schedule an appointment with so-and-so doctor. And we think that could really help empower patients to be much more proactive in their healthcare, lead to increased adherence to medication, and reduce the likelihood that chronic disease isn't treated promptly in a way that would then make outcomes worse for patients. But it's the type of thing that I think AI researchers, if we could push this along and do appropriate studies around it and get it actually deployed into the field, could change the lives of millions of people in the US.